I am Tammie Lee Demler. I am Director of Pharmacy for the Office of Mental Health and Director of Pharmacy for the Buffalo Psychiatric Center. I also am past president of the Pharmacist Society of the State of New York, and I'm honored to be here today. It's such a privilege to share with you what I feel is a good pharmacist. After reflecting on who is a good pharmacist, one of the readings that we were given to look at, it was interesting for me to see that many people felt that knowledgeable was on top of their list of pharmacists and what a good pharmacist would have as far as a trait. I added that to my list as well. I thought knowledge certainly is important, but knowledge not just didactically, not knowledge that you get from a book or from reading and learning. It's also knowledge about life and life's experiences. It's dynamic, it's continual, and it's lifelong. One of the things I point out to my students is that so often when you graduate, the feeling of formal learning sort of stops. But now that I've been practicing for 20 years, I learned that learning really never stops, and it actually gets to be more intense because the complexity of care as we journey throughout our professional lives gets to be more complicated, and our patients also seek more understanding and more knowledge from us as pharmacists. I also add that we need to make a point to explore knowledge. A good pharmacist doesn't settle for status quo. They're always looking to learn more and to explore things that they don't truly understand. Many colleagues I work with find that teaching can be so scary in some capacities because they don't know everything, and I think people believe they need to know everything to teach. That's not in fact the case. We come into teaching and mentoring of others with the knowledge set that we start with, and we expand on that, and we learn from each other, and we learn from our students. So knowledge would be on my list of what it takes to be a good pharmacist. In addition to that, I share with you that intelligence, although certainly intelligence is on the top of the list of pharmacist attributes, intellectual intelligence is only a part of that. Emotional intelligence I find to be something as a core belief of my own personal drive. Emotional intelligence is really understanding what your emotions play into the role of the pharmacist and understanding the emotions of your patients. We deal with sick people, people who don't feel well and come to you looking for help, but that doesn't always make for an easy interaction. Often it takes that pharmacist to be able to stabilize the conversation and to really make that patient comfortable in learning, because when we're uncomfortable or sick, we certainly don't feel like we always catch all the points. So we need patience as well, but emotional intelligence is right there up there as well. Using intuition to dig deeper. Now, intuition isn't something we learn. Intuition is something we have to work at if we're not comfortable with having a full detailed description of what's going on, to be able to dig deeper into our patients' lives. Case in point, person comes from their doctor, they've got a prescription, perfectly diagnosed, perfectly dosed, written so that it's legible. Pharmacist fills it, gets it to the patient correctly, timely, and all is good. Patient can't afford to take the medicine. You know, at the point at the register where they're talking to you, sharing with you their more personal details about losing a job or having a devastating circumstance in life where they can't pay for their medicine, that intuition factor plays in there, where then you need to help bridge that patient's medication therapy. If they're not going to take it because they can't afford it, is there something more we can do? So using your intuition to be able to detect therapeutic complications is key as well. I wanted to also mention, before we get off emotional intelligence, is to know what emotion plays in sickness and illness, and how that makes our patients a little bit more challenging at times, but certainly responsive if we take that extra bit of time with them. Empathy is another trait of pharmacists, and reflecting on what is a good pharmacist, the authors included that as well. Empathy isn't just being able to say you can relate to somebody. It's truly being able to have the capacity to recognize what they're dealing with. Not saying that you completely understand, because unless you've been there, you can't understand. But you could share feelings to some point. Something like, I really understand that can be frustrating, or this must be really scary for you. Let's walk through this together and we can really come to a resolution that works and that makes you more healthy. Empathy is critical, especially when somebody's sick, dying, or trying to stay well. Personality, being personable, being relatable, being credible. Oftentimes pharmacists can have a perception of being that person on a pillar all the way back in the pharmacy. We need to come to our patients. We need to be credible and relatable, and so being able to get to a level of their personal circumstance, cultural, ethnicity, demographic, societal challenges. We may not always be on the same level with all of our patients, but being able to speak to them with credibility and showing that you care makes the total difference. Pharmacists that are good need to be interested. You need to be interested in the world around you. You need to be able to be a member of an organization. You need to be wondering what's going on with legislation, with laws, you know, who's in office, who represents you. You need to vote, you need to be invested, you need to care about your community, and you need to do things such as community service that are not always related to pharmacy. Sounds counterintuitive when I say what takes to be a good pharmacist, do something that's unrelated to pharmacy, but the more we populate and penetrate and integrate within our communities and show we care about where we live and who we take care of is really truly a mark of a good pharmacist. And your patients will see you doing those things, and they'll know you're invested and you care about the community. Once you wear that white coat, you never take it off, even if you are in other areas and in different societal roles and obligations. You are a pharmacist wherever you go. I wanted to mention too that you need to be able to be invested in mentoring others. We don't all feel we might be good teachers, but we have plenty to teach, and it just takes a little bit of practice. Practice makes perfect, and you don't ever know everything. So I would advocate that a good pharmacist tends to try to mentor others, and it doesn't have to be a pharmacy student initially. It can be your technician. It can be the person at your cash register. Certainly we're educating and mentoring our patients, you know, helping them through their illness, but being able to coach and mentor others, that's a real skill, and it's a really good thing to be able to move people in the right direction. You never know what cashier or technician today may pursue pharmacy as a profession tomorrow if you really demonstrate your investment and interest in that practice. You also need to be able to have the desire to make a meaningful difference. Every day I wake up and I go to my psychiatric facility and I practice my clinical role. I know that I'm making a difference, at least in one person's life every day, and that contribution, that legacy, I feel makes every day worth it, and makes the fact that I worked really hard to become a pharmacist truly worth it as well. You need to seek knowledge of things that you don't fully understand. As I mentioned before, we don't know everything, but oftentimes we fall short of pursuing that deficit of knowledge. So much to learn, the pace is so fast, medications are being released daily that we don't understand. That pace, I hope, will never slow, because we're always hoping that new novel therapies come to market, but always explore things you don't know. Share your expertise with your network of organizational members. If you're in an organization, share information, not just legislatively, but clinically. Asthma may not be my expertise, but I know people who have asthma as their expertise. Call on them, ask for further understanding, because no doubt your patients are going to come to you with questions in all levels of expertise. And don't sell short the fact that your family members will too. Once you're a pharmacist, a good pharmacist will share that information no matter where they are in life. And last, I'll share with you, I think being a good pharmacist requires good communication. Oftentimes we feel that, of course, we communicate. We speak, our language clearly to our family. You communicate with people on a daily basis, but communicating with patients is a completely different thing. You're dealing with people who have all different levels of knowledge. Some people with very, very little ability, little literacy and ability to communicate. Language barriers that you're going to need to be able to navigate through. You'll have to kind of think through the fact that if you're working in an area where somebody may speak Spanish and you don't, how will you communicate with that patient and find the resources to be able to do so? You'll need to be able to listen before you speak, and I think that's the hardest thing for us when we're communicating, is that we want to say things, but we don't often pause and listen. And to be able to find out what the question really is, you need to know that first. And sometimes you'll get cues and clues that are unrelated to what the original question is that may further allow you to dig deeper and to be able to help that patient understand more fully. I had a situation where I was helping rectify an issue where a mom who was a first-time mom was giving her baby medicine, and it was liquid amoxicillin, and the baby had an ear infection, and the mom was giving the baby that antibiotic medication that should have been given in the mouth in the ear, because of course she understood that this was for an infection in the ear. Why wouldn't this liquid be instilled in the ear, even though the label said take? a teaspoonful 3 times a day. Her interpretation of that was take it in the ear. So we need to be very clear in our communication. The cliche of let the patient read back the instructions to you really truly is not a cliche, because oftentimes you'll hear that in misinterpretation read back to you. So do follow that. And 20 years later, since my graduation, I still do that, and I've found there to be some significant gaps in communication, even though I feel I'm a good communicator. My patient population is those who have mental illness, and the cognitive challenges there can be extreme, but I never give up. I always try to work through, whether that takes a lot of repetition or having the patient read back and kind of role play, it does work. So be patient, work through it, but listen before you speak. Also speak clearly and slowly. That's just a tip for communication. And also be willing in terms of communication to go outside of the walls of the pharmacy. Communicate to your communities. Go to the Kiwanis clubs. Go to the Rotary clubs. Speak about issues that are hot and provocative in the community. You know, things that are medication related that otherwise might only get a snippet on TV, but you're the drug expert and you can really expand upon it. So make those networks, make yourself available. Nobody truly likes public speaking, I can tell you that, and you can work through it. Truly, with more practice, giving yourself more exposure, you can communicate clearly to those community groups. When we seek legislation, such as immunization for pharmacists, which just happened in 2009, we really had to call on those community groups to advocate for us, to be able to help them be well through immunization and vaccination. They had to understand that before the legislators heard it. So communicating to those groups now, before we need them later, really is win-win. And always explore ways of promoting the roles of pharmacists. Speaking on behalf of what pharmacists do, whether you're at a family party, in a Rotary Club meeting, or whatever, it does matter. People know that pharmacists play a great role in our community, and good pharmacists are very valuable. And last but not least, publish. There are things that you have to share that will be a legacy for all, and that'll further make understanding more clear. Whether that's in your local bee, your newspaper, be ready for a media interview. There are places and resources for you to seek out to be able to practice and to learn. Everybody can do it, and good pharmacists should know how. Thank you so much for letting me share that information with you today, and good luck.